republic for which it stands.
Thank you,
Thanks,
Senator
Mr.
Carper. Senator Johnson's next.
Thank you, Mr. Chairman. The title of this hearing is offensive as it is false. The Dobbs decision criminalized nothing. It just sent back the decision to the states. Again, the profound moral issue back to we the people. And I think the question that has to be decided is, at what point does society have the responsibility to protect the life of a baby in the womb? Now, Dr. Huntsberger, is there any point in pregnancy that you think a healthy baby's life ought to be protected?
I think healthcare decisions should be left between a patient and their doctor.
So there's no point that you think a healthy baby's child should be protected inside the womb? You're getting simple yes or no answer.
I think it's clear that the abortion bans are very significantly and negatively impacting patients.
Okay, you refuse to answer the question. I would like to play, but apparently I'm not able to, a call into a late-term abortion facility, a woman saying that she was 34 weeks pregnant and she wanted an abortion, to listen to the provider describe exactly how they are happy to perform that abortion, how they do it all the time, is abhorrent. But I'll enter it into the record, since I can't play it here. Just to verify that, check, see, are there really things like late-term abortion clinics? There are. They perform abortions up to 35 weeks. Dr. Francis, how viable is a baby at 35 weeks?
Well, thankfully, because of advancements in medical technology over the last 50 years, we've moved the point of viability of a baby outside the womb from about 28 weeks at the time that Roe was decided, down to now in some centers, baby as young as 21 and a half weeks gestation can survive. So at 35 weeks, with appropriate medical care, nearly 100% of babies will be able to survive.
So the extreme position on abortion is no restriction. Abortion basically up to the moment of birth of a completely viable and healthy child. That is the extreme position on abortion. When I hear this abortion bans, it's not a ban when you set a reasonable time period. Different states have different time periods, 12 weeks, 15 weeks. In Wisconsin now it's 20 weeks, 20 weeks. And all we're trying to do is protect life after that point. That's not a ban, that's protecting life. Again, let me go, this is, listening to the testimony here, it's like there's two totally different realities. Professor Goodwin is using terms torrid pandemonium, bleeding out in parking lots. Dr. Francis, is that the reality you're hearing? I mean, how many women have we been reported have been bleeding out in parking lots? And by the way, if they are afraid, maybe it's because here in the United States Senate's Finance Committee, we're holding a hearing that says women's health care now is criminalized. Maybe a title like that in a hearing is causing the chaos and the control. But Dr. Francis, I mean, is that a reality that you're witnessing at all? Pandemonium, bleeding out in parking lots, is that just an everyday thing now?
I'm certainly not seeing that in my practice, because I, like every other physician in the state of Indiana, intervene when I have a woman in front of me who's facing an emergency. I don't send her out to her car. I don't send her home and tell her to come back when she's more sick. I intervene immediately. Unfortunately, we are hearing circumstances of that, but again, I think it's important to understand whose fault that is. That's not the fault of the state law. Every state law provides clear exceptions for physicians to have actually wide latitude to intervene in an emergency if they are withholding treatment and they're not intervening. It is coming from a lack of understanding, which means that all of us on both sides of this issue should join together and call for better education of the public and better education of physicians.
So when there are politicians who refuse to acknowledge the fact that they want abortions up to the moment of birth, they won't be honest with the public, holding hearings that say now that women's health care is criminalized, maybe, just maybe, that type of rhetoric is seeping through into the consciousness of doctors, producing really a very regrettable situation like Ms. Joshua experienced, correct? I mean, I have no other explanation for that. If the laws don't prohibit it, again, I can't explain why doctors would not treat, because they're perfectly legally able to do so, correct?
I would agree with you, Senator. I think Ms. Joshua's story and the story that we heard from of Mrs. Miller last week are direct evidence of how these lies and misinformation that are being told about what state laws actually accomplish have direct harm on our patients.
I would say the title of this hearing is more dangerous and threatens more lives than the laws that I think you've ably described as allowing the kind of health care that saves mothers' lives. Thank you, Mr. Chairman.
One nation, indivisible,